Hey, the eccentrics beings. My name is Natasha Shalon, and I'm your host today. Whether you're watching me from YouTube or my podcast channel, the Eccentrics Beings Podcast, I want to welcome each and every one of you guys here today to my channel and podcast. And I want to say thank you to all my supporters that have been with me from the beginning, and thank each and every one of you guys who have joined along to join excuse me, on this train ride, and I'm so excited to see where God has taken us. And as always, I dedicate these videos to my future husband, future kids, future grandkids. I love you guys from the bottom of my heart. And to each and every one of you guys who are listening today, I just pray that each and every one of you guys will come into the will, the purpose of God, and do what God has called for you to do. Be all that God has called for you to be, and trust and believe that God will make a way for you out of nowhere. And so find your purpose and truly believe that you will love it. So today, if you're new to my channel podcast, once again, my name is Natasha Lund. I am a social media creator. I am a certified life coach and a registered nurse. And here you can find information, different topics really, but I try to focus mostly on nursing. So today's topic is going to be about altered mental status or confusion. So being a nurse, you see a lot of patients come in and out the hospitals. And one thing that I noticed is confusion. And what I mean by confusion, as a nurse or healthcare provider, we'll say altered mental status, and it's another word for confusion. And one of the key things, or one of the key diagnoses that as a nurse you may see is that. And one of the main causes of that, and I'm not saying this is always a cause of the confusion, but one of the main causes that I want you guys to know and look out for, because if you are a nurse or you're a future nurse or whatever the case may be, you can look out for these signs. So one main thing that relates to confusion is a urinary tract infection. And a lot of times we see a urinary tract infection in our elderly patients. Usually there's a high bacteria count in their urinalysis. So usually if you are suspected of having a UTI, they're going to do like a urinalysis. They'll tell you to pee in a cup, wipe and all that stuff. And you want to make sure that you're doing the proper technique so they can get the proper urinalysis, making sure that the urine's not staying out over 24 hours, because that can kind of deter the results of the test. So if you get your urinalysis and you work in the hospital, make sure you get it as soon as the patient voice, if possible. Go ahead and send it to the laboratory. A good tip too is when you're sending lab, you're going to want to put it into your biohazard bag. And then a good tip is to make sure that you actually wrap your cup in a washcloth. So when it's going up the tube system, because a lot of times we send these samples through the tube system. So if you can wrap your cup with a washcloth, and it'll keep, any urine from leaking out in the bag as it goes up to the tube system, go to the laboratory to get tested. And so I would say a good tip is to make sure that anyone, females can also be at higher risk, and elderly is at a higher risk too of getting. A lot of times we see it in the elderly people, but making sure that you're wiping always from front to back. So if this is the vagina, for instance, this is going to be the front of the vagina. This is going to be the back where the anus is. So you're going to always want to wipe front to back, never back to front. Why? You're going to bring any bacteria, any poop or anything that may be back there into the vagina area, and that's going to cause an infection. So these people who have UTIs, their altered mental status, their confusion is very serious, because sometimes families notice it and they may have a UTI in the past. And so, one of the main things I talked about before is listening to patients, listen to the family members, because they're typically the ones that know their families the most, the best, right? So if the family's saying something's not right with my family member, you want to do what you can to get the help that that patient needs. And that means going and reaching out to the provider so they can put in some tests. So just for instance, some tests that they may put in to see what may be causing confusion, they may do a CT scan of the head. They may do with or without contrast. Contrast is what they do to kind of magnify any areas, like the veins and stuff like that. So a CT of the head to see if they're maybe had like a stroke or anything like that. A good tip too, if you are a future nurse and you're in orientation or in clinical rotation, when you're looking at the CT results, just make sure that you never give the family as a nurse, because that's out of your scope of practice. So don't give the patients the results of the CT scan. Any diagnostic test, the provider has to do that. So know your scope of practice. But, you may want to allude that you also want to let the provider know. But if you're a nursing student and you're reading the CT, you want to always look at the CT and scroll down to the impression part. And if it's a negative CT, which means there's no signs of stroke or anything like that, then it may say no acute changes or anything like that. So just be familiar with those results so you can know and you can refer it to the next nurse also on the next shift. So I said one of the main things was a CT scan the provider may do. They may do a lot of blood work. So they may do a CBC. They may look at their blood work. They may look at their potassium, their BNP, which looks at their potassium, their sodium level. Sodium, if it's a high sodium level, it could cause them to be confused. Potassium may start to drop because if patient's confused. So let me give you some symptoms. So UTI symptoms of confusion, or a patient who is confused, they may not be eating proper. So they may have poor oral intake or food intake in their mouth. So if they're not eating correctly, they're not going to be able to poop correctly, right? So they may not be having first the proper nutrition, right? And then they may become dehydrated. With dehydration, we see the blood pressure starts to drop. So typical normal blood pressure is like 120s over 80s. So 120 being a systolic, that first number, 80 being the diastolic, that second number. That's a normal blood pressure. So any systolic that drops to less than 120, we start to get concerned. Well, I had a patient whose blood pressure dropped to like 88s, systolic, and I think it was like 77 diastolic. So that's another sign of dehydration. You're not getting enough fluids to raise the blood pressure back up. So when you have a lot of fluids, your blood pressure pretty much stays stable. So that's another thing when a person is dehydrated or have poor intake or intake, their blood pressure would typically drop lower. So the second thing, the doctor may order some IV fluids. They may have to bolus that patient with some fluids. So it may be a continuous fluid so they can get them back to where they need to be. Like I said, this patient with the UTI, third thing is they're going to want to put them on antibiotics. Antibiotics is the big one. One of the main types of antibiotics that they use for automental status, well, not automental status, but for UTIs is Bactrim. Now, keep in mind, Bactrim, some people can take it at first, and then when they go back and do another dose later on, they have allergic reaction. So some people are allergic to Bactrim, so make sure you know your patient's allergies as well. But this patient was not on Bactrim. She had to actually get on another type of antibiotic that was given IV. So keep that in mind as well. When they're confused, they're not going to want to take their medications by mouth. So you're going to have to reach out to your provider, reach out to pharmacy and see if there's an oral medication that could be given IV or, stuff like that. Another symptom I saw was the patient did not want to chew her food. So as being diligent, you want to make sure that you're looking out and reaching out to your speech therapist, because this patient was on a regular diet. And when I say regular diet, I mean this patient that day had like hard broccoli that even someone who has teats could not chew. So this patient was not chewing her food, she just was swallowing. So make sure that you're watching out for stuff like this. So if you see that the patient is confused, not able to swallow, make sure you reach out to the provider, reach out to speech therapy so they can do a speech eval if needed. And they may have to get them on a puree diet instead. So they'll have regular foods, but it just be very puree, almost like puree. When you think about puree foods, you're thinking about like baby food, like the Gerber and pudding and applesauce, almost like bananas mushed in together, stuff like that. I also want to say another good tip too with the elderly. When you're feeding the elderly patients, if they don't want to eat, because some of them get in their ways and they don't want to eat, a good tip is to take a little bit of pudding, applesauce, something sweet for them to eat. So you want to scoop their food up first, their regular food, and at the tip of that spoon, you want to put a little bit of pudding on it. And then a lot of times that'll get that patient to eat, because they like, a lot of older people love sweet. So that's another good tip that I would say too. And just thinking like, after this patient had this antibiotic, I noticed that, so the first day that I had the patient, she was all these things that I was telling you guys. She was confused. She wasn't eating right. She wasn't saying too much of words. She would just kind of repeat what we were saying. And from what the family told us, that she was more alert. She was talking. She was on the phone. So that day that she started the antibiotic and she got her treatment, the next day there was a huge improvement. She was talking more. She was sitting up. She was answering more questions. Her blood pressure actually came back up. She was more alert. And you can actually see the change. And I thank God for that, because that's why I say in one of my other videos, listening to your instinct, listening to God, who will tell you something's not right. You don't want to go to the provider, because they will get upset with you. I'm let you know, if you go to the provider and you just say, oh, my patient is just not right because I've done this, but you just know something's not right, they will get upset. Most of them will. But if you go with them also with also the other details, so be very detailed when you go to the provider, family saying patient is never like this or has been like this in the past, patient may be depressed too. Depression may be another thing why they're not eating. So make sure that you have your details in hand when you go to the provider. So you want to know all these details. You want to know the vital signs. When you're talking to the provider, when you're giving over information, they're going to know what is their vital signs, what is their blood pressure, what is their heart rate, what is their respirations, what is their temperature. We forget temperature. Are they in pain? We forget pain is one of those fifth vital signs that a lot of people forget, but pain is another symptom too, but we typically do forget pain. But so what are those things that you're seeing in your patient? And listen to God. God is going to give you insight. He's going to be like, something's not right in your gut, something's not right, and that's God telling you something's not right. So listen and don't just brush it off. You got to, like I said, you got to be bold. If you want to be anything, you don't even have to be a healthcare worker. You don't even have to be a social worker. You don't have to be a therapist. You can work at a desk. I don't care where you work at. It's not just healthcare. When God gives you something and tells you something and something's not right, listen to it, because it can save a patient's life. So be diligent in your work. There's going to be times you may be afraid and scared, but that's the time God is calling you to do what he's calling you to do, because he knows and he maybe sees something that you can't see at that moment, but he needs you to be diligent. He needs you to be confident. That's why I always say, we as the eccentric beings, we got to be bold. We got to be confident. We got to be eccentric. We got to know who we are, whose we are, and we got to walk in this thing. We got to go down and knock down the kingdom of darkness. You can't listen to naysayers. You got to do what God tells you to do. You got to do what God tells you to do. So that is so important for you guys to know, and just a sign to look out for in the future. And just could go for your family members. If you have elderly and they just confused, one of the main things they may have is a UTI, and knowing, it may be a 24-hour, 48-hour turnaround before they get better, but they need to be started on some type of antibiotics. You need to know the signs so they can get the right treatment. And you need to be diligent in what you're doing. So I just want to get on here. I didn't plan to make this video long, but I just pray that this helps somebody, because it helps me. And also having good nursing staff who been in the game for, maybe 10, 20 plus years, who have knowledge higher than you. Ask them, because they have experience. They may have seen things that you may not have seen before. So just thank God for the people that are around you. Thank God for who he is. Thank God for being the God. And I love him from the bottom of my heart. I love you guys. He loves you guys. So be faithful. Be bold, be confident, be eccentric. We are here to knock down the kingdom of darkness. Once again, I'm your host, Natasha Lund. Welcome to the Eccentrics Beings podcast. Welcome to the Eccentrics Beings YouTube channel. And I love you guys. I pray that you be blessed. I pray for peace, favor, protection, and the anointing of God over you and your families today. And I pray, importantly, for your salvation today, that you would turn to Jesus Christ, that you would know that Jesus Christ is the Lord and Savior over your life as he is Lord over my life. So I love you guys. Y'all be blessed in Jesus' name.